This is my supplies. Hello, my name is Cynthia Pineda. I'm a registered nurse who's currently in the graduate program at the University of South Alabama, and I'm going to be performing my neuro assessment for my 518 course. Do you consent for the neuro? Okay. And I'm going to be filming this and sharing it with my instructor for grading purposes. Do you consent?
Yes.
Okay. Before we start the neuro assessment, I'm going to have you memorize a few items, including a pencil, a water bottle, a tape measure, and a watch. So pencil, a water bottle, tape measure, and watch. To start the neuro assessment, I'm going to be doing the mental status examination portion of it first. I'm going to ask my patient, we'll first assess their appearance and behavior. My patient is relaxed, they seem friendly, cooperative, well-groomed, and appropriately dressed. I'm going to ask my patient some mood questions. Have you felt depressed or hopeless within the last 2 weeks?
No.
And have you felt little pleasure or interest in things?
No.
Okay. My patient has appropriate mood and appearance and behavior. I am then going to move on and assess my patient's orientation. So I'm going to ask you your name, like who you are, where we are right now, and the date, including day, month, and year, and who the president is.
Okay, my name is Matthew Willis. The president is Donald Trump. The date is October 31st, 2025.
Mm-hmm.
And what was the last question?
Where are you?
And I'm at home.
Okay, so my patient is alert and oriented times 4. I'm now going to ask my patient about judgment and perception questions. So if the light turned yellow, what are you going to do?
Slow down at the light.
Okay. My patient has appropriate judgment. I'm then going to ask my patient memory questions. So I'm going to start with the immediate memory. I'm just going to have you repeat a phrase real quick. The house is blue.
Okay. The house is blue.
Okay, so my patient's immediate memory is appropriate. And can you recall the items that I had you remember at the beginning of the assessment?
The pencil, tape measure, water, and watch.
Okay. So my patient's recent memory is intact. And then I'm going to ask you a remote memory question, which is what color was your car, your first car?
Okay. Red.
Okay, so my patient's remote memory is intact. I'm now going to ask my patient abstract reasoning question, which would be, what does an apple a day keeps the doctor away? What does that mean?
Eating healthy keeps you healthy through the rest of the week.
Okay, that's appropriate abstract reasoning. And my last mental status exam question would be a calculation question, which would be, what is 4 plus 3?
7.
That's correct. So my patient's calculations are correct and appropriate. I'm now going to move on to my cranial nerve assessment. So I'm going to start with the cranial nerve 1, which is the olfactory. For olfactory, I'm going to have you test each nostril to make sure that it's patent and like you can like smell out of them. Okay, and now I'm going to have you close your eyes and cover one of your nostrils, and I'm going to have you smell something. Go ahead.
Mm-hmm.
Can you tell me what that is?
Lemon.
Okay. The next one.
Peanut butter.
Okay. My patient's cranial nerve 1, which is the olfactory, is intact. I'm going to move on to cranial nerve 2, which is the optic nerve. I'm going to be using the Rosenbaum acuity chart. My patient's going to have it about 14 inches away from their face, and they're going to read the smallest line available. We're going to do that with the left eye, the right eye, and both eyes. So cover one of your eyes, and we can start with, that's his right eye. Hold this about 14 inches from your face and read the smallest possible line.
Start at the top.
or the smallest one that you can read.
Okay. 4, 2, 8, 3, 6, 5, 3, 7, 4, 2, 5, 8, 9, 3, 7, 8, 2, 6. And I can't see the smallest
So
line.
you read from here.
Mhm.
So my patient's visual acuity for that right eye is 20/25. And then go ahead, cover the opposite.
Okay. 9, 3, 7, 8, 2, 5, 4, 2, 4, 7, 3, 6.
You read this one?
From this one down.
Okay. So this one?
Mhm.
This one?
Yeah.
Okay, so again, that's 20/25. And then I'm gonna have you with both eyes open again, hold it about 14 inches from your face and read.
Okay. The bottom line, 4, 2, 6, 7, 3, 9.
So again, that's 20/20. So my patient's visual acuity for both eyes would be 20/20. And the Snellen chart requires you to be 20 feet away from the Snellen chart. So it would be the same process. My patient would read the smallest line, switching eyes, and then with both eyes, the top 20 indicates the feet distance the patient is from the chart, and then the bottom number indicates the feet distance that a person with 20 like perfect vision can see the chart. So the lower the bottom number, the worse, the higher the bottom number, the worse the vision that a patient would have. So my patient's cranial nerve 2 is intact, and we went over the Rosenbaum and the Snellen chart for that. Now I'm going to be assessing cranial nerve 3, 4, and 6. Cranial nerve 3 is the ocular motor, cranial nerve 4 is the trochlear, and cranial nerve 6 is the abducens. With this, I'm going to be using a pen light, and I'm going to be also using the chart to determine what pupil size my patient has. So first I'm going to be assessing them. And my patient's pupil size is at a 3 millimeter. I'm now going to have you, with the light on, just kind of go towards you and just don't move your face. My patient's pupils are equal, they're symmetrical, they're round, they're reactive to light, and accommodation and convergence is appropriate. I'm now going to do the extraocular movements. So without moving your face, I'm going to have you just follow. So my patient has no nystagmus and no extraocular eye movements. I'm now going to move on to cranial nerve 5, which is the trigeminal nerve. With the trigeminal nerve, I'm going to have you clench your teeth down, and I'm going to be massaging or palpating the masseter and the temporal, which both feel equally contracted and symmetrical. I'm now going to have you open your mouth and move your jaw side to side. And as you can see, it's symmetrical again with even movements. You can go ahead and stop. And now I'm going to assess my patient's sensation on the face with dull and sharp sensation. So go ahead and close your eyes. You're going to tell me if it's dull or sharp.
Sharp.
Close.
Dull. Sharp. Dull. Sharp. Sharp. Dull.
So my patient's trigeminal nerve is intact, and that is again the cranial nerve 5. Cranial nerve 5. We're gonna move on to cranial nerve 7, which is the facial nerves. I'm gonna assess my patient's face while it's relaxed, which is symmetrical, which is appropriate with that. And then we're going to move on to have the patient puff their cheeks. Okay, which is again symmetrical. Smile, frown, and raise your eyebrows. Again, everything is intact, so my cranial nerve 7 is intact. I'm going to move on to cranial nerve 8, with the vestibular cochlear nerve. With that, I'm going to have you cover one of your ears and close one of your eyes, or both of your eyes, I'm gonna whisper about 2 feet away from my patient, and they're going to be able to tell me what I said. Okay, what did I say?
The sky is blue.
Okay, and then the next ear, go ahead, close your eyes. Nope, you're gonna just look straight ahead.
The house is red.
Perfect, so my patient's cranial nerve 8, which is the vestibular cochlear, is intact. Now I'm gonna move on to cranial nerve 9 and 10, which is the glossopharyngeal and the vagus nerve. To assess this, I'm gonna have you just say a phrase for me. So I'm gonna have you say, the house is red.
The house is red.
So as you can see, my patient's phonication of the sentence is normal. There was no difficulty in saying that sentence. There was no hoarseness. I'm gonna have you open your mouth all the way. And the tongue is midline, the palate is elevated, and the uvula is midline. Now I'm gonna have you say ah.
Ah.
Again, the uvula rose and the palate rose as well, and that was symmetrical. I'm gonna have you, again, open your mouth. I'm gonna be doing the gag reflex with a tongue depressor. Open. Say ah. Gag reflex is intact. And then for the last portion of this cranial nerve, I'm going to have my patient drink. As you can see, both of those muscles on the neck were a symmetrical movement while he swallowed. So the cranial nerve 9 and 10, the glossopharyngeal and the vagus are intact. I'm going to move on to cranial nerve 11, which is the spinal accessories. I'm going to have you push with your shoulders moving up against my hands. Okay, so that is again symmetrical and even. Perfect. And then I'm going to have you move your head side to side against my hands. So go ahead, move side to side. And that is even and symmetrical. So cranial nerve 11, spinal accessories are intact. And then the last cranial nerve is cranial nerve 12, which is the hypoglossal. I'm going to be assessing the tongue. So you can go ahead and stick it out and then move it side to side. Again, as you can see, this is symmetrical with no difficulty doing this movement. And after that, I'm going to have you press it against your cheek against my hand. So go ahead and do it on the other side. And they are symmetrical with even strength. So the cranial nerve 12 hypoglossal is intact. Now after the cranial nerves, we're going to do some motor function tests, which include coordination, gait, and doing the Rosenberg exam. So for coordination, I'm going to have my patient pat on their thigh up and down with their hands rapidly. As you can see, this is even with equal strength and done rapidly with no difficulty. Okay, you can stop. I'm going to have you, with your thumb, move across the fingers with both hands rapidly. And my patient has no difficulty doing this. So this is great rapid alteration movements, coordination movements, they are intact. Okay, and then I'm going to have you again put your heel to the opposite shin and just move it down. And then the next one. Okay, great. So again, the rapid altering movements and coordination are intact. I'm going to have you now do your gait. So I'm going to have you stand up. And I'm going to have you start here and then walk back. It does not have to be heel toe, just normal gait. As you can see, my patient has symmetrical gait with no difficulty. There's no excessive swing. All right, and then now you're going to do heel toe walks. Again, no excessive swaying. My patient is able to have symmetrical walking. And now we're gonna do the Rosenberg test, which would include have you kind of stay on your side here, like right here. Hands relaxed, feet next to each other, close your eyes. And I'm gonna have him stand like this for about 15 to 30 seconds, and we're gonna be assessing for any excessive swaying or a need for my patient to take a seat, which would indicate a positive Rosenberg exam. But as you can see, my patient is steady and no excessive swaying, so this would be negative. Okay, you can go ahead and take a seat. Now we're gonna do some sensory function tests. The first one is for pain. I'm gonna go with a cotton swab on each extremity, and he's gonna indicate whether it's dull or sharp sensations. You can close your eyes.
Sharp. Dull. 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 Sharp. Sharp. Dull. Sharp. Dull.
And that's appropriate pain response. Now I'm gonna go to proprioception. For proprioception, I'm using the pinkies and the big toe. You can fully relax, and I'm going to move them up and down, and my patient will indicate whether it's going up or down. Okay, so close your eyes.
Up, down, up, down, up, down, up, down,
All right, relax your legs.
up, down, up, down,
Relax.
up, down, up, down.
Correct. So my patient has good proprioception. Next is stereognosis, and I'm gonna have you close your eyes again with your palms out. I'm gonna have you identify this object with your eyes closed.
Spoon.
Correct. So my patient has appropriate stereognosis. And the last exam for the sensory is graphoresis. So I'm gonna have you again with your palms up. I'm gonna write a number, and you're gonna have to identify it.
0.
Okay, next.
3.
Okay. My patient has appropriate sensory response for graphoesthesia. So now I'm going to be doing the reflexes. The first reflex will be the bicep reflex, which is located about here on both arms. Your palm will be facing downward and relaxed. I'm going to be hitting the bicep tendon here with the mallet directly on my thumb. And you see a 2+ reflex. Next, relax. And there's a 2+ reflex. Now I'm going to move on to the tricep, which is above the elbow and behind. This will be hit directly, the palms up and bent. Okay, so this one first, again this one. And this is a 2+ reflex. Moving on to this one. Just relax, relax, relax. And that is a 2+ reflex. After the tricep and the bicep, we're going to move on to the brachioradialis, which again, slightly facing you, bent. No, relax, relax all the way. It's going to be 2 to 4 inches from the wrist, about here. That's a 2+ reflex next, about 2 to 4 inches. And that's a 2+ reflex. I'm going to move on to the patellar, so relax all the way, like move so that your legs are like dangling. For the patellar, the legs are dangling. We can move, nope, that's fine. I'm going to put my hand, allowing it to rest, the thigh to rest on my hand, and it'll be down here. And that's a 2+ reflex. Again here. 2 plus reflex. We're gonna move on to the Achilles, which I'm gonna dorsiflex the foot, relax, 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 relax. Dorsiflex, and we're gonna strike right above the heel at the visible Achilles tendon when you dorsiflex it. And that is in 2 plus reflex intact. Again, dorsiflex right above the heel, right behind the leg on the tendon that's very easily visible when you dorsiflex the foot. And that's a 2 plus reflex. Last is the plantar flexion or test here for the Babinski. I'm gonna have the patient relax all the way. And we're going to, the patient curl their toes in, which is appropriate, and that is a negative Babinski, right here. Again, the patient's curling their toes in, again, negative Babinski. And we're going to also test for ankle clonus, so we're going to dorsiflex and plantar flex our foot rapidly. There is no clonus noted, so dorsiflex, relax, and again, there's no clonus. And that concludes my neuro assessment. I'm just going to pan the room real quick.